People who have cancer, what signs let you know that you were sick? Story 1. I was diagnosed with a stage 3 occult breast cancer. I had a new kitten who obsessively licked at my armpit. A few days later I felt a fullness feeling in the same armpit, so I went feeling around and found the lump that led to my diagnosis. I had no other symptoms, was too young for routine mammograms, which wouldn't have helped anyway because it was occult breast cancer, so nothing showed up on breast imaging, and the cancer was very aggressive. I would have been dead in 6 months if it weren't for my cat. He saved my life. Story 2. 9-year-old niece was extremely lethargic. Other than that she was fine. Doctor decided to run some cancer screening on a whim, leukemia. She died of an infection on her last round of chemo. Story 3. I had some odd blood test results that weren't quite right that my doctors checked a little more closely. There were some minor aches and pains that I thought were something else that I had in the past. I still haven't really had many symptoms. The plus side is that it was caught very early. The doctor told me, this is not going to be the reason you die, which is an oddly comforting yet ominous way to deliver a cancer diagnosis. Story 4. My mom had severe stomach pain. She got her stomach checked out. Nothing. They checked her pancreas. Stage 4. 3 months later she was gone. She didn't even make it to her second chemo. Guys, please get your cancer checks. Story 5. Mine was an intense pain in my rib cage to where I couldn't breathe that would happen every so often until it got to the point where it got so bad and wouldn't go away. It was stage 3 synovial sarcoma. I was 16 then, I'm 28 now, and I've been cancer-free for 11 years. Story 6. My mom had breast cancer and she had no symptoms. It was caught on a routine mammogram. Thankfully she had surgery to remove it and went through a year of chemo and radiation therapy and is now cancer-free. Story 7. My dad, age 36, severe headaches, brain cancer, was given 3 months to live. Chemo gave him 9. My mum, age 45, loose bowels, very aggressive and already in her liver, was given 12 months. No option for chemo, radiation or surgery, just painkillers, gone 4 weeks after diagnosis. Story 8. My dad had serious heart problems starting at an early age. It's hereditary. I had my bypass surgery 10 years ago. Anyhow, my mom and dad were at a CVS waiting for prescriptions. My dad, as usual, tested his blood pressure there. My mom said it's free, so she tried it out. Her blood pressure was sky high. After talking to the pharmacist, thinking something was wrong with the machine and testing again a few more times, he urged her to follow up with her doctor. She did. After a bunch of testing, they discovered she had stage 4 small cell lung cancer. She had no idea. I went to the oncologist appointment where he told her there was about 5 chance of making it 5 years. It's super hard to treat small cell lung cancer because you need to kill 100 of the cancer cells. 999 is not good enough. She lived about another 20 years and died of normal old age. She beat it somehow. Lesson learned, never give up. Like Jim Carrey said in that move, yes, there is a chance. Story 9. Family history of female reproductive system cancers on both sides of the family. Was told I was too young to worry mid-20s, but pressured them to check. Sure enough, cells that were just turning cancerous. Several surgeries later and I've been clear 12 years. Story 10. At first, I XED out of this post because it was scaring me, but then I thought I should really read through all these comments to know the signs symptoms. I'm at that age where I really should be getting yearly checkups and tests. Story 11. My brother had consistent toothaches, but he didn't like the dentist. By the time they scanned his jaw, it was already cancer-riddled. He didn't make it. Story 12. I bumped my head on a car door and it swelled up a bit. After a week or two, it seemed off that the swelling hadn't gone down. Went to see a doc. Turns out they found lesions that were indicative of multiple myeloma, which is an incurable blood cancer. My doctor estimates that I had had it for 8 to 10 years before being diagnosed. It's just not something they test for. The only symptom that could have been an indicator was lower back pain. But I'm older and overweight, so it's not like that was anything surprising. Story 13. My GP noted protein in my blood. A bone marrow biopsy revealed a high percentage of cancer cells. My oncologist says the disease has responded well to treatment, as shown by lab reports. Otherwise, I have not actually seen the disease. Story 14. My bestie used to get frequent painful headaches. Her dad used to have medical books and she would read them and convinced herself she had cancer. I thought it was so far-fetched BC we were very young. Like 20 years old. Imagine my shock when it turns out she did in fact have brain cancer. She went through treatments and was in remission. A year or two later she got married and became pregnant. Unfortunately the cancer returned. She had to make a decision. Continue with the pregnancy and forego treatment, which she wanted to do, or abort the baby and start aggressive treatment immediately. Her husband convinced her to do the latter. And unfortunately, it wasn't enough. The cancer had spread. She passed 2 months after her 24th birthday. Ironically, exactly 15 years later, my mom also passed from brain cancer, on the same date as my bestie, February 15th. She got sick in November 2019, and was gone 3 months later. Her original symptoms were confusion, headaches, brain fog. Within the time of battling it, she lost her hearing, her ability to walk. It was a quick demise in a short span on time. It's been 25 years since I lost my bestie, and I still miss her and think about her often. 5 years since I lost my mom and I think about her daily and miss her terribly. Story 15. My father and mother-in-law both had cancer. 0 symptoms. My dad had a doctor say, I don't like that mark on your skin. Let's cut it off. After more intense surgical procedure following, he's been cancer-free. My MIL had cancer removed during a colonoscopy. They did another one to check on it, and it was removed entirely before she even woke up and they told her about it. Get your routine cancer checks. Story 16. So I don't know if I have it yet. Blood cancers take a while to screen for properly. What triggered the screening is I regularly donate blood and plasma, and of course they tested for dangerous before using it. Well, ID given plasma, waited the 2 weeks, and went to book myself in right on time. The app said I wasn't eligible to donate anything. Tried the website, same deal, weird. Well, I call up to see what's what. Lady on the phone takes a look at my file and says she's transferring me to the health team. They say they're mailing me a letter I need to take to my doc because some of the values were off. Red blood cell count under standard range, white blood very under standard range. Go to my doc, have to get another test done. ID managed to keep red level by eating a fuckload of red meat for 2 weeks, spiked my iron though. White has dropped even further. Next test holds level. One more to go, and if it's not back up, I'm probably getting a bone marrow biopsy to test for leukemia. The thing that really got me worried though was after the first test with my GP getting worse, I had to explain to him that I've had a lot of CT scans in my life, starting at 10 years old and had like 6 since the start of COVID, as well as other exposure to hazardous radiation, and worked with a lot of carcinogenic chemicals at uni, often being a bit blasé about my PP. He needed to consider me higher risk than an average person. One thing I will say is this, nobody tells you just how bad the waiting is. Have to wait a month for more blood work. Doc is booked up, so have to wait a week to see him, and I can't see the results until then. It puts a real emotional drain on you, and there have been multiple times I've been on evening walks and get in my head about what do I tell my family. I live alone, so how much support will I actually get if I need chemo? Do I even tell my friends? I certainly can't tell the one that's pregnant and add more stress. There's a wedding coming up, how well will I be equipped to even go? Just wandering dark streets lightly crying and freaking out behind my glasses. The waiting man, think of like a really stressful exam you've had, not sure if you'll pass or fail, how worried you were waiting for the results, now multiply it to a level of this may actually kill me. Story 17. My best friend died of colorectal cancer. She had bleeding after bowel movements for 8 months before she told her doctor about it. She'd assumed it was hemorrhoids. Her doctor hit the roof when she finally said something. She was already in stage 4 when the cancer was discovered, with it having spread to her lungs and liver. She lived another 2 years, and the period around her death remains one of the darkest times of my life. Story 18. None. I'm into my 5th year of CX, been stage 4 for 4 years. Although I have no symptoms from the cancer, I have plenty from the chemo I did 4 years ago. I'm on my second drug trial that I drive 4 hours one way to, one of the biggest cancer centers in the USA, and am going every week. No fun at all. Feel free to AMA. Story 19. My mom kept vomiting this past Thanksgiving New Year's. Seemed a little confused. Nothing alarming, it was flu season. Then she had a seizure on 16, deadliest and most aggressive brain cancer. She hasn't been home since the seizure, and will pass soon. Story 20. I was diagnosed last year with severe rheumatoid arthritis, which causes nodules to form in your lungs. I have a few present all under 1 centimeter though, so my doctor does x-rays every 3 months or so to monitor them. Well, just in 3 months' time between one set of x-rays and the next I have had 3 spots, the largest of which is almost the size of a peach, that have popped up out of nowhere, and they're not consistent with RA nodules. I'm scheduled for some imaging scans on Thursday to be followed by a biopsy, so I'm not certain of anything yet, but I wouldn't have known they were there if my doctor wasn't already doing routine x-rays. Only symptoms I've noticed have been a sensation like a lump in my throat because one of the masses is pressing on my trachea and a mild dry cough. Story 21. Weight loss, tiredness, pain in flank, no appetite. The tumor had compressed my stomach. GP said it was heartburn for 8 months. This is the CT scan. I lost my kidney, part of my stomach, my core muscle, plus other bits and bobs. Luckily 10 years on I am still clear, but the doctor was useless. But before everyone says get a second opinion, he was the head parter at our doctor's surgery, so when I saw other doutors there, they wouldn't go against him. No local doctor's practices were taking on new patients, so it wasn't the best, but I'm alive, rocking some wicked scars and living the best life I can. Story 22. Mom was burping a lot, some heartburn. Doctor decided to do an endoscopy. Found out she had a rare cancer that has a low survival rate. That was 7 months ago. She has gone through chemo and had her stomach removed, but she seems to be doing better. She was fine otherwise, but knocking on death's door during chemo. Story 23. Ovarian cancer survivor. Just had my second child and periods were getting progressively worse. I had nagging back pain which I attributed to bending down a lot for diapers and everything else that comes with having small kids. I went to the doctor for a routine follow-up and just suddenly inexplicably started to cry. She asked what's wrong. I responded I don't know, but can we do an ultrasound? I know something isn't right, but I don't know what. Got a call a day after that ultrasound. There was a 10 centimeters mass on my ovary with suspicious features. MRI confirmed cancer. Lost my ovary but was so lucky no chemo needed. The symptoms were overall mild, and had I chosen to ignore my gut instinct, I suspect I would be here typing this. Story 24. My only symptom was a lump on my neck. Took the doctor's months. The lump growing to the size of a softball and a biopsy to diagnose non-Hodgkin's lymphoma. All blood work was clear. I was 35 and just gave birth to my second baby 6 months earlier. I've been in remission for almost 5 years. Listen to your body, folks, and advocate for yourself. Story 25. I was mostly fine. I just had a bump in my neck clavicle area and very bad night sweats, but otherwise I felt normal. Turns out it was lymphoma. Finally finished chemo today and hope that I beat cancers. Story 26. I started having what I thought were perimenopause symptoms. I was 45, so I figured it was about time. A few months later, my giant puppy jumped on my stomach. It started to swell up the next day. It progressively got worse over a few days and became really painful. I went to the ER and was diagnosed with ovarian cancer. Story 27. I had an incredibly small spot on my nose that would bleed if I picked at it. And I'm a skin picker. I admit it, this spot, slightly bigger than a pore and flesh-colored, would bleed longer than you'd expect. Skin cancer. I'm 38 and tanning was all the rage when I was a teen. Not just tanning beds, which were popular, but avoiding sunscreen when you were going to spend a day outside to get a little color or get a little sun. One of the top songs was Soak Up the Sun. Millennials, if you, like me, took zero precautions in your youth to avoid sun exposure or went tanning, I cannot stress this enough. Make a full body appointment with a dermatologist to check for spots. It isn't just obviously dark moles that change shape or weird spots you need to worry about. It can be insidiously normal looking. I started having excruciating pain during my periods. Like, go to the ER and vomit into a bag while you wait level of pain. Story 28. My mum couldn't lose weight and she was bloated. She ate very healthy and walked, so it was odd. She had to cough a lot, burp, etc. Turns out to be ovarian cancer, and she maybe lived 2 years. Wish doctors thought about it. She was the age for it as well. Not enough is known, as many women experience these symptoms without it being anything deadly. Story 29. My grandfather went to get up out of a chair and his lower arm just snapped. Bone cancer. He had some rare aggressive form and died 9 days later in agony. Bones started breaking with every movement. At the very end his ribs would break just by breathing. Finally they were just collapsing under the weight of his body. The local doctors only knew of one other case like this, and it was my grandfather's brother-in-law, who grew up in the same neighborhood in another city. Story 30. My lymph nodes started to swell. Then my neck started to swell and I started to have reflux and coughing fits at night. I went to the doctor and he told me I was tense and needed a massage. A month later, I was admitted to the hospital with blood clots in my lungs, fluid around my heart and a stage 4 non-Hodgkin's lymphoma diagnosis. I'll have been in remission for 3 years this fall. If something feels off, advocate for yourself. Story 31. My cousin went to the dentist and they found these sores on the back of her tongue and suggested she get them checked out. Several doctors told her it must be an STD and refused to do any further testing. A year and a half later she finally got a diagnosis and spent another year and a half having invasive surgeries in her face and neck from some of the best facilities in the country, but it was too late. The cancer was a foot long and completely wrapped around her trachea. She died a few weeks ago, a couple days after her 35th birthday. Story 32. My uncle was diagnosed with stage 4 lung. He had concerns about shoulder pain for a year, no x-ray or anything from his primary care. They sent him to PT even though he had history of working in asbestos for many years. Turned out it was a large inoperable lung mass. He passed 3 months following his terminal diagnosis. Doctors need to listen to their patients. He had concerns something felt off and he was right. Story 33. Took a knee to the side working with a disabled client. Caused a ton of pain for me to go in and have it checked out. They did an x-ray and CT scan and said we're bringing in a doctor to go over these results. 10 minutes later, you have testicular cancer, several chemo treatments and an orchiectomy later. I'm cancer-free 11 years. Story 34. My aunt was bleeding heavier than normal. 8 months of being told at menopause nothing to worry about. In and out of hospital knowing something was seriously wrong. After 8 months she was finally diagnosed with stage 4 cervical cancer. Story 35. My husband had a headache for 2 weeks. Hardly ever got headaches. Went to the ER to get it checked out. It was glioblastoma. Absolute shock of our lives. He's in his early 40s, almost a year into this nightmare, and he's stable for right now. I can't even begin to describe what the shock of your life being turned upside down in an instant does to you mentally, physically and emotionally. Story 36. Constant dry cough that didn't go away for months, night sweats, feeling like I had the worst allergies ever, but it was the middle of winter, then ever-increasing difficulty breathing. It was like trying to breathe through a wet sponge. It was a malignant neuroendocrine tumor in a lung. ETA. It is believed to have been doing a massive histamine dump. Normally these do not cause symptoms. Story 37. My best friend had no symptoms at all. She was 23 and grocery shopping one day and had a seizure that brought her to the ER. Scans revealed a brain tumor that had been there for a decade. It had been slowly growing and one day it pushed against something in her brain causing the seizure. It has been a very long road to recovery over the last 7 years. Story 38. Blood in my stools off and on. I was an idiot and ignored it for years but had recently started a new medication that exacerbated my symptoms and decided it was finally time to get it figured out. I 38F went in for a combo endoscopy colonoscopy and they removed a 2.5 centimeters polyp. Looked normal. Doc didn't seem concerned. Results came back cancer. 2 months later, I had surgery to remove 2.5 of colon on either side from where the polyp was removed. Everything came back negative. Officially listed as stage 1 colon cancer. One of the extremely lucky few. Don't be like me and ignore things for years. Get your colonoscopies. Story 39. I was in the army and was having a harder and harder time with PT, especially with running. The cancer I have is rare and mimics COPD. The army medical thought it was asthma, but all the albuterol in the world wouldn't help. I got out on shitbag status thinking I was the worst soldier in the army. This was the era of burn pits in the news, and after many an uphill battle, the VA said it was COPD, more inhalers of increasing strength, constant breathing tests, seeing a revolving door of useless pulmonologists who did not believe me at all. Eventually a shoulder x-ray caught it, lung biopsy and diagnosis followed quickly. No cure, hardly treatable, average lifespan 5 years after diagnosis. That was 2010. Story 40. I randomly mentioned to my mom and GF that my throat had hurt during dinner one day. But then COVID came, so no DR appointments, and the pain wasn't that bad, and a few months went by and the pain went away, but I had a DR appointment unrelated to my throat and my mom was with me, and she randomly brought up my throat pain from 2 months ago. I told the DR that was months ago, and it didn't hurt, but he felt my neck and said, "You have a bump, let me send you for a scan," and it came back suspicious, so I got a biopsy done, and it came back 99 cancer. Apparently there's no way to actually know if it's 100 cancer till it's out. Story 41. No history of cancer here, so I didn't really expect the diagnosis. I started losing a lot of weight without dieting, was constantly fatigued, went to DR, they didn't find anything, had a regularly scheduled mammogram 2 months later that showed a very deep lump that couldn't be felt. The second time, I had a clean mammogram, but 2 months later I found the lump. Always do a thorough monthly check, press your doctors for more testing if they can't find anything wrong, don't let them dismiss your concerns for any unusual symptoms. Story 42. My good friend had weird gynae and GI symptoms for months. Her doctor had sent her for tests and found nothing. She would faint just from standing up. One day, the doctor sent her for an abdo-CT. She called me sobbing. She had stage 3 ovarian cancer and huge amounts of fluidicities in her peritoneum. She finished her nursing degree and worked as a school nurse, all while having treatment. Ovarian cancer is a mostly silent disease and has a very high mortality rate. I miss her. Story 43. Absolutely nothing. I went in for a well woman exam and it came back with irregular cells. They said it's likely just HPV, will clear on its own, etc. Biopsy said otherwise. Story 44. Found a hard lump in my breast in the shower with no other symptoms. I really thought it wasn't going to be anything, but of course it was breast cancer at the age of 30. Also because of this we learned our family carries the BRCA1 gene mutation, and now everyone is getting checked. I'm 32 now, cancer-free, but still really struggling to process everything that's happened over the last 2 years. Cancer really sucks. Get to know your body and get anything new or abnormal checked. Story 45. I'm reading all of these while I'm having crippling fatigue and brain fog. Is it allergies, perimenopause, or am I dying, and do I trust my docs enough to do a decent workup to figure it out? Story 46. My mum's was caught in a routine mammogram and required a mastectomy. My grandma had it too, so after a genetic test that showed I carried a bad gene, I'm getting a preventative mastectomy, so we'll hopefully never have to deal with it. Story 47. I had painless lumps in my neck. Something in my gut told me to get it checked. I had stage 3 Hodgkin's lymphoma. That was 42 years ago. Yes, some cancers are curable, thank God. Story 48. Nosebleeds. Every day, around 200 milliliters bleeds each day. Neck lymph node metastasis. Severe aching pain in neck. Not able to open mouth. Hearing problems due to eustachian tube blockage. Tumor spread to my abdomen. Had no symptoms there, maybe because I swallowed the nose blood leak during sleep. It was terminal. I should have been dead long before. It was 11 years ago. Story 49. My aunt felt hot and had trouble breathing. She also had a cough. Doctor sent her away with a puffer, and she was gone 3 weeks later. Cancer in stomach, lungs, liver and brain. Story 50. I had a big lump protruding from my chest 1 diameter that didn't go away and felt like popped up overnight. Thought it was hormonal, went off my BC and it didn't go away, so I went to my doctor who thought it was a lipoma or fibroma since it was mobile, kinda soft, and didn't feel like what you're told a cancerous tumor should feel like. He sent me for a mammogram to make sure it was nothing to worry about. Turns out it was something to worry about. Story 51. I lost my voice. Couldn't sing anymore, was a professional singer, for months voice therapy, didn't help. Scan, doctor saw mass, redirected to doctor for lungs, big mass in lung, mass blocked voice cords, stage 4, chemo, no chemo, traveling, and now almost 2 years after diagnosis JN hospice, probably my last 2 weeks. Smoked weed for more than 40 years, tobacco a bit less, enjoyed the smoking, so no regrets, just a bit younger dying than I thought. 57 years, carpe diem guys. Story 52. My 2-year-old had diarrhea. Then 2 weeks later, it was even worse. The health department inspected mine and grandma's house to be sure we weren't doing something wrong, or I guess if we were living in filth. Grandma was absolutely offended, but nothing was noted. 3 months later, she still had diarrhea. 10 months later, she was almost 3, losing her hair and weighed 23 pounds. They finally found a tumor lodged between her liver and kidney. It was neuroblastoma. Her tumor was saved for further research. DRS at the Children's Hospital said the diarrhea was what saved her. Neuroblastoma doesn't typically cause diarrhea. She's a big healthy college graduate now. Story 53. Dad complained of back pain on a Saturday. Woke up on Sunday with more back pain and the whites of his eyes were yellow. Went to the ER. They sedated him for an MRI. He had terrible claustrophobia where they diagnosed him with metastatic pancreatic cancer. he got sepsis and died a couple days later. The oncologist saw his dad die slowly over 18 months from pancreatic cancer, and he actually told us it was a bit of a blessing how my dad passed. I totally agree. I watched my brother-in-law fight and ultimately die from esophageal cancer. It was horrible. Chemo is terrible to go through, and dying slowly from cancer can just be horrifically painful. Story 54. I had unusual fatigue, elevated resting heart rate, and elevated heart rate while exercising running for many months, then eventually night sweats, unintentional weight loss, and my left supraclavicular lymph node got really big. Hello lymphoma. Story 55. I had 2 episodes of seizures in my sleep. My then GF thankfully was there and it woke her up. They originally misdiagnosed it as a stroke, but after the follow-up scans weeks later, it was revealed as a brain tumor. Story 56. Nothing. My puppy smacked me in the nuts and the pain led to an ultrasound and so on and so forth. Mine doesn't show in blood tests either, so got lucky, I guess. Story 57. Just complete exhaustion. Falling asleep during all my daily tasks. I started falling asleep while driving and that scared the absolute out of me. Still had to fight tooth and nail to get my PCP to do blood work. She just kept saying it was mental health related. I have OCD. Luckily, at the time I nannied for a nurse practitioner and told her what I was feeling. She ordered my labs and turns out I had stage 3 liver cancer. My PCP dropped me as a patient when I got my biopsies back. Story 58. Losing 20 pounds in 2 months. Initially, they thought it was my gallbladder, had it removed. I was still puking bile and feeling terrible, though I was in and out of the ER so much that doctors, friends, and my then husband thought I was making it up. Literally had an ER doctor make me take an Ativan before head talk to me. When I called my former MIL, who was a pharma rep and knew some good doctors, she meanly told me to get a psych evaluation. I called my best friend in tears, and she told me this call that bluff, go in, but don't leave until they can prove it's all in your head. So I did. They took all my things away, and I talked with the doctor. Since I wasn't having a mental break, he asked me what was going on, then he admitted me for observation. It was in the hospital when I asked a nurse if passing a lot of blood in stool was normal. She said no, got a doctor, and I had a colonoscopy a week later. I was diagnosed with stage 3 colon cancer at age 37, no genetic history, nothing. If I hadn't listened to my friend and my intuition, I'd be dead by now. Story 59. My mum's nipple inverted and I begged her to see a doctor. Stage 4 breast cancer, but she thankfully survived for a decade longer. It came back with a bad cough she couldn't shake sadly. She had lost a lot of her ribs and spine to Mets at that stage and they had to rebuild with metal. We got 3 more years from there. Story 60. So many aches and pains that never got better. Your body stops being able to heal, fight off infection. One of my friends found out from an ear piercing that never healed. 2 others from ER visits when the pain got so bad they couldn't ignore it any longer. Another and myself from sizable lumps. Moral of the story, when in doubt, get it checked out. Story 61. I was having increasing pain in my testicular region, over the course of about 3 to 4 months. At first I thought I had slept wrong, or hurt myself playing sports. That was until I started to have breathing pain. Found out I had stage 3A testicular cancer, just recently celebrated 9 years cancer-free. Story 62. My sister had low-grade nausea for months, like really low-grade. Figured it was anxiety because she has generalized anxiety disorder. Then one day the side of her neck began swelling up. You couldn't miss it. Turned out to be non-Hodgkin's lymphoma. She is cancer-free now. Story 63. My grandma only experienced shortness of breath and her GP had her sent to the hospital when the antibiotics for pneumonia didn't work. He suspected bronchitis, small cell lung carcinoma. She passed away 6 weeks after diagnosis. The only option was chemo to extend her prognosis from 3 to 6 months. But she didn't want that because of the side effects. She wasn't in pain, only suffered shortness of breath. Note she was 80 years old and had been smoking like a friggin' chimney since the age of 15, so I think she reached a very respectable age for her habits. We as her family weren't surprised when she was diagnosed. Story 64. 0 symptoms. I 22F was studying abroad and I was the healthiest I'd ever been. Got a routine checkup and one test led to another and I was diagnosed with Hodgkin's lymphoma, blood cancer. This was in December 2024, had to quit my uni and come back home for treatment. 2 weeks from now is my last chemotherapy. Cancer is a horrible disease. Story 65. I had night sweats and enlarged lymph nodes in my neck. My resting heart rate was 120 BPM. Was diagnosed with stage 3 Hodgkin's lymphoma after procrastinating going to the doctor for months. Really wish I would have gone sooner. Story 66. Leukemia. Started as some light weight loss and fatigue that I attributed to stress, then starting getting bad leg pain. Then the pain started traveling to my bones, but it was consistent. My teeth would hurt so bad I barged into my dentist and begged them to take my permanent retainer off. Instant relief. My skull would hurt, my kneecap on one leg would hurt, then the other leg it traveled around my body. Doctors thought it was rheumatoid arthritis. Then I got random swelling in limbs, the dots on the ankles. By the time they got me in for a CT scan, they called me an hour later and said you need to drop everything and go to the ER right now. 85 of my blood cells were cancer and I had sepsis. My girlfriend said I'd been smelling weird for weeks, and my pets were clinging to me all day. Turns out I was almost dead. Story 67. Me and my friend worked together at a liquor store, both heavy drinkers. One day he was out for like a week and his first day back he said, "Dude, I've had this insane hangover for like a week," and then he explained that he couldn't keep anything down. He lost a ton of weight and was very pale. It took the doctors weeks to find out what was wrong. It was non-Hodgkin's lymphoma. He died about a year later. Story 68. My mom's cancer got detected in first stage itself triple negative. She had the rare type which was terminal. After 2.5 years of fight, she passed away. I don't know if an early screening would have helped it or not, but don't take your health for granted. Few signs were she got fever frequently and was under a lot of stress before all this happened. Stress management is very important. Was obese as well. I hope that helps. Story 69. My mom started losing weight. My parents thought it was diet and exercise. She was at the dentist and the dentist saw her gums bleeding and immediately said to get a biopsy. She's had acute myeloid leukemia since February. Story 70. Get a yearly physical. Saved my husband's life. His kidney cancer was detected while checking creatinine high levels. Had nothing to do with the cancer, but it led to an MRI that found it. Oh, and he had 0 symptoms. Story 71. My brother had bleeding and pain when he used the bathroom. He was late 30s, early 40s, so they chalked it up to IBS. They recommend a colonoscopy, which he didn't get. He found out when his colon perforated because it was riddled with tumors. A year later he was gone. Colorectal cancer is striking younger. Ask for a colonoscopy if you have symptoms or family history. The prep really isn't that bad and the nap is great. Story 72. People and DRS advise not to Google symptoms because all results will end up as a cancer diagnosis. But after reading the comments, I think paranoia can potentially be a lifesaver. I don't trust doctors, and I can't wait to suspect something to get it checked. Are there any specific tests I can do regularly, aside from mammography and blood tests? Story 73. Severe fatigue. Not the "oh, I worked a long day, I am tired." It was "I lifted my arm up, now I need time to recover from that." I stopped eating, started losing weight, night sweats, low blood pressure when I have hypertension and almost passing out when standing up. I also started getting lumps on my neck, and what finally drove me in was I thought I had strep. I had leukemia and was dying and had strep. Story 74. My mom had a deep, thick cough for about a month. She also had stomach pain, so she was cutting out dairy. Turns out she had stage 4 ovarian cancer and her lungs were filling with fluid, which is why she had the bad cough cancer. Answering on behalf of my dead grandpa so I can spread the word further, a lump in his breast and maybe some extra fatigue, though he had other health issues. Men get breast cancer, check your pec, especially if you are larger or have gynecomastia because they're easier to ignore then. He was an introverted, proud Vietnam vet and didn't want to deal with embarrassment or bad news. By the time he told me and my mom, it was golf ball sized and hard as a rock. It grew daily once we were watching and he was dead within a month and a half. I'm grateful that he allowed us to care for him in spite of his feelings of humiliation, and grateful that he died right before it fungated. Check your chests. Story 75. The 2 main signs I had was severe back pain that left me unable to get out of bed. I was 11 at the time. I'd miss school occasionally because of how bad it was. The other symptom was reoccurring fevers with no cause. I'd get fevers like clockwork once a week for a day or two. No other symptoms with the fever like a cough or running nose, just the fever. I found out later that the dark circles under my eyes were a symptom as well. Doctors growing up would say it was allergy eye or genetic though. Even though I'm cancer-free now, I still have the dark circles under my eyes, so I don't pay that symptom much stock. If anyone is ever worrying about it though, it never hurts to ask for a simple P-test, tumor marker test, to see if you have cancer.